So good afternoon dear students, I am Professor Dr. Vikas Mishra, and today I will be discussing the next part of Spaulding classification, that is how do you decontaminate or disinfect the medical devices which are being used in hospitals. So for this, first we need to know what are the terminologies and definitions. So first of all, what is antisepsis? It is the chemical destruction of vegetative pathogens on the living tissue. Then what is sanitization? It is lowering microbial counts on eating and drinking utensils is to safe levels. Now please keep in mind that we are discussing all this which is related to the hospital environment. That is whatever is being used in hospital, the devices which are directly medical devices or certain other devices which need to be disinfected. Sepsis is bacterial contamination. That is when the environment or in the system you have a lot of bacteria which is present. Asepsis is an absolute absence of any microorganisms in that particular environment. So aseptic techniques are used to minimize the contamination and transmission of infection. Now what do you mean by cleaning? Cleaning is physical removal of foreign material, that is either dust, soil, organic material such as blood, secretions, excretions, and of course the microorganisms which are present. And this is accomplished with water, detergents and their mechanical action. So what is decontamination? It is the removal of disease producing microorganisms to leave an item safe for further handling. Sterilization is known as complete elimination or destruction of all forms of microbial life accomplished in healthcare facilities by either physical or chemical process, in which you also kill the vegetative as well as spore forming microorganisms. Disinfection is cleaning some or all pathogenic microorganisms from an article, surface or medium of which it may cause infection. A perfect disinfectant should offer complete and full sterilization without harming other forms of life. It should be inexpensive, it should be non-corrosive, and it should not harm the healthcare workers' health or patients' health. Unfortunately, as already told, an ideal disinfectant does not exist. We already know what is high-level disinfection, intermediate disinfection and low-level disinfection, which we have already talked about. But in short, high-level disinfectants destroy vegetative bacteria, mycobacteria, fungus, enveloped and non-enveloped viruses, bacterial spores, but not necessarily all bacterial spores. For that, the contact time may increase of that high-level disinfectant. So intermediate level disinfectant kill vegetative bacteria, most of the viruses, most of the bacteria, most of the viruses, most of the fungus, but not the bacterial spores. The low level disinfectant kill most of the vegetative bacteria and some fungi as well as enveloped viruses such as hepatitis B, HIV. Low-level disinfectants do not kill Mycobacterium tuberculosis bacteria or bacterial spores. So low-level disinfectants are typically used to clean environmental surfaces. As already discussed, Spaulding classification, 3 device categories for disinfection and sterilizations are used. That is critical devices, semi-critical devices and non-critical devices. Critical devices are those devices which enter the sterile tissue or vascular area. Therefore, they pose a high risk of infection if contaminated with microorganisms. Disinfection, you require high level disinfectant or sterilization. Semi-critical devices come in contact with mucous membrane or skin that is not intact. Therefore, they pose a moderate risk of infection if contaminated with microorganisms, and they also require high level disinfection. Non-critical devices come in contact with intact skin but not with the mucous membrane. Therefore, they pose a very little or almost no risk of infection if contaminated with microorganisms. So they require either intermediate or low level disinfection. Now, management of blood and body fluid spill. How does spill is managed in healthcare setting? So first of all, what are the tools of spillage kit? Number one, protective clothing, gloves, gown, mask and goggles which a healthcare worker needs to wear to protect himself. Tissue paper or rolled paper towels which are used for absorbing of that biological fluid which has caused spillage. Then forceps for removal of any material such as broken glass or other sharp objects. Then a freshly prepared sodium hypochlorite solution, or you can also have chlorine tablets which are dispersible, which dissolve in water. You can freshly prepare the following concentration. Then you also need to have a biohazard disposable bag for infectious waste. You also need to have a torch along with this so that you can get a reflection of small glass particles which are present on the floor. They can be easily picked. Then measuring jar and certain other accessories such as adhesive tape, clippers, etc. The chlorine releasing agent fall out into two groups. Number one, sodium dichlorocyanurate, which is known as for in commercially available has Tabsna, Precept, ये दो नाम से आती हैं, and sodium hypochlorite which is known as household bleach या brand name Clorox के नाम से भी आता है. तो any of these can be used as disinfection reagent. Now how to clean the blood and body fluids spill? First, whenever there is a spillage, you need to cordon off that area so that the infection is not transmitted to the persons. You need to cordon off that area. Then you need to place a wet floor sign near the area of spillage for accidental fall, prevention of accidental fall. Then the trained healthcare worker has to wear protective clothing and gloves. Put on the goggles if splashing is likely, especially in the cases of dialysis patient. Then you have to put on shoe cover to protect shoes if they are likely to become contaminated with the blood spill. If there is any broken glass or any sharp object is involved in the spillage, you need to have a forceps to pick up and throw it into a puncture-proof sharp container before any cleaning or disinfection is attempted in order to manage the injury. So first you pick up all those materials and put it safely in a puncture-proof container. Now you have to effectively clean the spill. So first you have to cover the spill, that is the liquid, with paper towels. Okay, so they will absorb and concentrate that solution in a particular area. Then you pour on that freshly prepared sodium chloride solution, that is Clorox solution 1:10 dilution over the spill, which you have to start from periphery to the center, and then you have to leave it for at least 15 to 20 minutes. Mind you, contact time of disinfectant is very important since a lot of organic matter is present there, so you need to increase the time to 15 to 20 minutes there. This will ensure ample contact time for disinfection. Then you wipe out all the fluid or biological fluid from the surface. Again pour or spray the disinfectant which you are using, that is Clorox in 1:10 dilution, on the area of spill, and again leave it for at least 5 minutes. This will ensure ample contact time for disinfection once again. Then wipe clean with paper towel. Discard all the contaminated paper towels into the infectious yellow bag. Dispose all personal protective equipment into that yellow infectious bag. And now you use accessories such as adhesive tape to properly close that disposable yellow plastic bag, and then you put it into a yellow infectious waste container, that is yellow bin. Then effective hand hygiene, wash hands with antiseptic detergent and replace and replenish the supplies in the spill kit which you have already used. So this is how spill is managed, and then after managing you have to document that in which area what was the spillage and how did you manage it and what was the time. After you have managed the spill, then you can remove that signage, and then again entry of healthcare workers or patient can be allowed in that area after effective cleaning. Now we should know that how we need to mop the floor. Use a mop or bucket system with a floor cleaner solution beginning in far corner of that room under the bed and then moving towards the bathroom and door. Mop the floor in 1 to 2 meter square sections. Mop edges with straight strokes and then continue working from side to side in backward direction using a figure of 8 pattern on the remainder of section, turning the mop frequently. The floor should be fairly dry on completion. Now you should know this effective cleaning in all the patient care areas in figure of 8, starting from the periphery to the center and then migrating to the door. And the contact time is also very important. For cleaning and disinfection of bathrooms, wash the water and detergent. First, initially you should wash it with plain water, running water and detergent. Then you should make a Clorox or bleach solution, that is 40 to 50 ml of bleach in 1 liter of water. Then you disinfect all the hard non-porous bathroom surfaces. Start with the highest surface like the mirror and leave the toilet for the last. Ensure that all the surfaces including the sink area, mirror, the grab bars, shower fixture and the other door knobs etc. are thoroughly disinfected. Disinfect and clean toilet exterior, toilet seat surface and outer of the bowl. For inner of the bowl, use 250 ml of pure bleach with contact of at least 5 minutes. The concentration is increased to 10% and time is decreased. So this is how we need to clean the or disinfect the bathrooms. Now this slide clearly shows you what are the high touch surfaces area. Bathroom cleaning protocol should usually use best to start with the highest surface, often the mirror, and leave the toilet for the last. Clean and disinfect all hard non-porous surfaces along with that. Mirror, sink area, grab bars, shower fixtures, toilet exterior, toilet seat surface, outer and inner bowl are very necessary. Then using a clean mop, mop the entire floor surface, working your way from the far corner back to the entrance of that bathroom. Visually inspect the and ensure all surfaces have been cleaned and disinfected. Then disinfect any cleaning equipment like mop handles before returning to the cleaning cart. Remove your PPE, put it in yellow trash, tag it with a tape and put it in a yellow bin. Then perform effective hand hygiene and return with clean linens and you prepare that area. So this is how we clean the bathrooms. Now, as I told you what are the high touch surfaces of the patient room, this slide shows that areas. You can easily see the grabbing area of the bed, the telephone knob, the cardiac monitor, the doorbell, the grab bars, the pillow area. These are the high touch surfaces area, telephone stand, which everyone keeps on touching, may or may not without disinfection. So after touching any high touch surface area, you should effectively clean your hand. And during the disinfection procedure, it is the responsibility of the supervisors to take care that these areas are effectively taken care of. The low risk areas, talking about these areas are usually not contaminated with blood or body fluids or with associated infectious pathogenic organisms. So the risk of infection is minimal in these areas. So routine cleaning, the kind of cleaning you do in your home, is usually good enough for these areas. You should clean these areas with a mop damped with detergent and water. And these areas are usually administrative areas, waiting rooms, non-sterile supply areas, medical record area, engineering workshop, central store, library, conference and meeting area, and staff changing areas. So these are the clean areas which do not have the pathogens there. So a simple detergent and water mopping is more than enough for these areas. Now, intermediate and moderate risk areas. These are the areas used for the care of patients who are not obviously infectious and not highly susceptible. These areas are cleaned by procedures that control dust such as damp-proof mopping with detergent cleaners. Dry sweeping or vacuum cleaner are not at all recommended. Jharu is contraindicated in a healthcare setting. Dry mopping, contraindicated. Wet mop, yes, this is there. The use of detergent solution improves the quality of cleaning in these areas. The functional areas in this intermediate risk areas include patient wards, outpatient department, physiotherapy area, pharmacy area, laboratories, mortuary, radiology, accommodation that is housing areas, employees health clinic and cardiology department. Now we come to the high risk areas. These functional areas are those areas which require effective disinfection or sterilization. Why? Because there is more risk of transmission of the microorganisms in this, and therefore it is known as high risk area. So what are the high risk areas? Number one, CSSD, that is Central Sterilization and Supply Department, which caters all the sterilized linen, instruments, wash pads, etc., which are to be supplied all over the hospital where there are sterilized. That area is CSSD department. The emergency department, where you know that unknown infectious agent you may encounter because the patient primarily reaches that area, and there you make the diagnosis. So the first time you encounter the patient in emergency, you do not know what infection is it that patient having. So that area is also a high risk area. Certain catering facilities includes all kitchen and cafeteria, because any food contamination would lead to diarrhea and dysentery of all patients irrespective of wards. Then the day surgery unit, where surgery patients are admitted. Treatment room, maternity ward, pediatric surgery ward. These are the high risk areas. Then very high risk areas are there where greater potential of pathogen contamination with infectious material or more are concerned about potential infection transmission to both patient as well as healthcare workers. These areas must be cleaned with care using a cleaning solution with a separate cleaning equipment. जो आप सेमी हाई रिस्क एरियाज में यूज कर रहे हो या इंटरमीडिएट एरियाज में या क्लीन एरियाज में यूज कर रहे हो, उससे इनके मॉप्स, डिटर्जेंट, डिसइंफेक्टेंट्स टोटली अलग होने चाहिए. So these detergent solutions which are required here are different from that being used in intermediate area according to the hospital policy. So what are the functional areas here? Here you have isolation room, where you isolate certain very infectious patients such as C. difficile patient, MRSA patient, swine flu patient, coronavirus patient, tuberculosis patient, etc. Intensive care unit, where the intensive care is being provided to the patients, which may be ICU, PICU, NICU. Operation room, that is operation theatre. Neonatal care unit, that is NICU and nursery. Okay, delivery room, labor room, where labor is being conducted. Certain immunocompromised patient areas where you are keeping the immunocompromised patients which are on the treatment, like dialysis patient or chemotherapeutic agents are being given to, anti-cancer drugs are being given to cancer patients. So now we come to decontamination of environment and equipment. So this slide is really very important for the healthcare workers. You need to know what are the items, what is the cleaning process, and which staff is responsible for this supervision for cleaning. So airways and ventilator tubes in ICU should be cleaned with disposable. Either they should be used disposable, that is single patient use, or they should be disinfected with 100 ml of bleaching in 900 ml of water solution, which should be dipped in for at least 10 minutes, then air dried and reused. there should be a documented reuse policy in that area. Before cleaning or disinfection of that area, you should document it. Ambu bags. Again, use disposable. That is the best policy. If not possible, then disinfect with 100 ml of Clorox or bleaching solution in 900 ml of water for at least dipping it for 5 to 10 minutes and then air dry. Baby bath, you should clean the bath after use with detergent and water. Disinfect with 100 ml of bleaching in 900 ml of water solution. You can also use spray for that. Baby frames and cradles in which PICU babies are kept. Again, 100 ml of Clorox in 900 ml of water solution spray you can be used. And housekeeping personnel should be using these, should be assisting in cleaning of baby bath, baby frame and cradles. Whereas ambu bag, ventilator tubes, it is the responsibility of nursing staff to clean. The blood pressure cup, anti-tourniquets which are present in nursing care areas should be effectively cleaned by nursing staff. It should be soaked in detergent and water, dried thoroughly. If contaminated by any biological fluid such as blood or pus, then you should spray on it at least 100 ml of Clorox which has been diluted in 900 ml of water. That is 1:10 dilution. Ceiling should, if visibly soiled, should be washed with detergent and water. It should be cleaned by maintenance department. The housekeeping personnel, that is class 3 and class 4 employees, should clean the commodes and urinals with detergent and water, followed by cleaning with 250 ml of Clorox, pure Clorox, and contact time should be at least 5 minutes. Curtains. The curtains which are used in high risk areas and semi high risk areas should be laundered at least 6 monthly. And whenever it is visibly soiled, whenever you see that it has been visibly soiled by biological fluids such as blood, pus, urine or feces, you should immediately send it for laundering. Some curtains may need to be laundered more regularly in high risk areas, that is every 15 days. If unable to send to central laundry, you can even clean it at that site if they are waterproof with detergent and water. And this is the responsibility of laundry department to take care, and nursing staff should supervise it. The dressing trolley which is used for dressing and giving medications to the patient should be effectively cleaned by the nursing staff. First, you should wash with detergent and hot water and dry before and after use. If again this trolley is contaminated with blood and body fluids and used for patient with transmissible infection, you should have a reference policy or guidance, and 70% alcohol wipes can be used to disinfect trolley between uses. If visibly clean, use 100 ml of Clorox in 900 ml of water solution spray. So this is how you clean that. IV stands which are present in the hospital bed should be cleaned effectively by nursing staff or class 3 employee under the supervision of nursing staff. You should always start from top to bottom. You should start from top to the bottom, clean with water and detergent, rinse and dry thoroughly. If contaminated with blood and body fluids, again use 1:10 dilution of bleaching powder or Clorox solution and effectively leave it for 5 to 10 minutes. Wipe it or let it air dry. The examination couch should always have a disposable linen there. After every patient examination, it is essential, especially when there is contamination by the biological fluid in it, you should take care that it is cleaned with 1:10 dilution of Clorox in 900 ml of water and contact time be 5 minutes. Floors. You can perform dry cleaning as well as wet cleaning. Dry cleaning is dust attracting mop is available. Sweeping machine must not be used in that area. For wet cleaning, you should always keep a disinfectant, that is either Clorox solution, that is 2500 or 2700 particles per minute of chlorine in at least 40 to 50 ml of Clorox in 1 liter of water. This is the diluting solution which is used, and it is done by housekeeping personnel. And mind you, for every ward, it is essential that in every shift this mopping should occur. But in very high risk areas such as labor room, such as operation theatres, ICU, NICU, CCU, it is to be done by housekeeping personnel every hourly, because mechanical decontamination is the best way to clean the area and have microorganism free environment. Now certain housekeeping equipment are used, such as buffers, that is floor polishing machine, pads, buckets, mop heads. These are also cleaned by housekeeping personnel, and the buffing pad should be washed with detergent and water and drip dried. Pad must not be left under machine between uses. Clean the bucket with water and detergent after use and disinfect with 1:10 dilution of bleaching powder. Dry and store it opposite inverted, so that nothing falls inside. You should always disinfect the mop heads which are being used in hospital with 100 ml Clorox in 900 ml water, that is Clorox solution, for at least 15 minutes, mind you, and then you have to let it air dry. You can even send it to laundry after disinfection for effective cleaning. The baby incubators are to be cleaned by nursing staff. If disinfection requires, refer to manufacturer's instructions which are given, as some allow wash with water and detergent only. Better use Savalon for that, and others allow use of bleaching because it is slightly corrosive. So certain baby incubators do not recommend. So you should always go towards manufacturer's recommendation that what is allowed for disinfection of these incubators. Incubators should be disinfected between each baby. The incubator shall also be disinfected after every 7 days of hospitalization, that is every 5 days for baby less than 1 kg. After use, all removable part must be washed and thoroughly cleaned with detergent. Better use Savalon because it is less toxic. Then soak it in 1:10% of Clorox or bleaching solution for at least 5 minutes. Rinse and dry thoroughly using a paper roll or absorbent towel which is disposable. Then clean the incubators with water and detergent. Again, better use Savalon, it is less toxic, or you can use Savalon wipes for that. You should disinfect the incubators in 1:10 dilution of bleaching of water solution wipes and dried using paper roll. Humidification chambers which are used for oxygenation should always be first disassembled with the humidifier. Clean the humidifier and reservoir with 1:10% bleaching solution, that is 100 ml of Clorox in 900 ml of water solution for at least 5 minutes to 15 minutes in high risk areas. Thoroughly dry the parts before reassembling. Decontamination of incubators which are in use. All incubators that are occupied should be cleaned daily from inside and outside using Savalon wipes and dry it with the paper towels for the better, so that the patient, the baby which is inside the couch, does not get irritated by the smell of bleach. The blood and body fluid suction containers which are used beside the beds which are present. Always after every use, empty the contents carefully, sluicing in it in a toilet or a wash basin which is typically designed for disinfection of that suction chambers. No other thing should be used there. Carefully you dip it in warm water and detergent, avoiding splashing, and disinfection should be done accordingly, that is dipping in 1:10% of bleach for at least 15 minutes, and it should be performed under supervision of nursing staff by the class 3 employees, that is ward boy Aya or ward boys. Then for the laryngoscopes which are used in ICU, it also has blade. First of all, handle wash with detergent and hot water and dry thoroughly. If contaminated by any biological fluid such as sputum or blood, or it is being used in any infectious patient who is suffering from tuberculosis or pneumonia, always first disinfect with 100 ml bleaching solution in 900 ml of water, that is 1:10 dilution. Dip it in that solution for at least 15 minutes, and then you should effectively clean it with detergent and running water. Allow it to dry, then clean it with alcohol rub and place it inside the container for reuse. And of course, The blades after disinfection should be sent to CSSD for reprocessing or dipping in 1% of glutaraldehyde or even bleach. Then the cot, incubator, mattresses, beds and pillows. You should always regularly check to ensure that cover of that is intact. It has a non-porous cover, plastic material का होता है, so that within the pillow the biological fluid does not get inside, and it should be crack free. You should always ensure before cleaning that it is crack free. So you should take out the linen which is covering, that is the pillow covers and the mattresses. Check for any cracks which are present on that. The mattress cover should be well washed with lukewarm water and detergent, and then it should be disinfected with either 1% bleach spray or any quaternary ammonium compound, and allow it to dry for at least 10 to 15 minutes. And this is to be performed by housekeeping personnel. Certain medical equipments you should clean with alcohol wipes. The resuscitation trolley should always be cleaned with detergent and water and should be disinfected with 1% sodium hypochlorite solution. The should always be scissors and any sharp instrument should always be first disinfected in 1% sodium hypochlorite solution. Then you should clean it with detergent and send it to CSSD for effective sterilization. Of course, the blood pressure instrument should be cleaned with detergent and water, and if possible absolute alcohol wipes. Stethoscopes, telephones, thermometers should always be wiped with 70% alcohol wipes between use of each patient. Then the ventilators. It is very important that you wipe the surfaces of ventilators, clean working from the top to bottom for greasy or stubborn soiling. Use the non-abrasive pad. Wipe the screen with alcohol. The body can be wiped with either absolute alcohol or 1:10% dilution of bleach. Allow it to dry. Only detergent and water can be used if it is advised by the manufacturer. Otherwise, you should not use it. The bedpans, bowls should always be first disinfected in bleach for at least 15 minutes, 1% bleach, and then cleaned with detergent and water, allowed to dry. Wheelchair and certain toys which are used in nursery should also be cleaned with detergent and water and disinfected with 1% bleach spray or any quaternary ammonium compound sprays. Regarding dialysis unit, cardiac monitors, dialysis machine, diagnostic imaging machine, ECG machine, you should always wipe the unit screen with alcohol. The body can be wiped with alcohol or 1:10% dilution of bleach. Allow it to dry only, and detergent and water can only be used if they are advised by the manufacturer. Otherwise, you should not use. Okay. Now we come to the glucometers. Simply damp wipe with 1% bleach or alcohol wipe is much better. Defibrillators also in the same way should be cleaned with 1% bleach or water solution. Stretchers and the other mediums of wheelchair, as already told, should be effectively cleaned after each use. They should be wiped by alcohol wipes or they should be effectively cleaned using 1% bleach spray, and contact time should be at least 10 to 15 minutes. Now the personal protective equipment which are advised during environment cleaning, so that healthcare worker is not affected by it, that he should wear a proper disposable or waterproof gown. He should have a face mask. He should wear goggles to prevent eye splashes of disinfectant. He should wear heavy duty rubber gloves and rubber boots. So properly he should wear every personal protective equipment which is designed for cleaning of these equipments. So in short, I would like to say that any material or article which is being used in hospital need to be disinfected after each use, and between the use you should always see whether it has been visibly soiled by biological fluid or not. If it has not been soiled by biological fluid and it is not infectious area, even a detergent and water wash is more than enough, and after that alcohol wipe is effective. In the infected areas, of course, after cleaning with detergent and water, contact time with 1% bleach or any other quaternary ammonium compound by at least 15 minutes is necessary. But for any technical devices, you should always include the manufacturer's instruction. Without their instruction, you should not use water or detergent because they may hamper the efficiency of that equipment. And of course, there should be a daily checklist for environmental cleaning as it is shown in this slide, and it should include each and every area starting from the high touch area to the floor, walls, and whatever the additional requirement equipments are being used in that area. And this is how we perform the cleaning and disinfection of the household, the medical devices which are present in hospital. Thank you very much for your kind attention.